This is chapter 11, part 4. We're going to talk about what you do when you need to add a drug to an IV piggyback. Okay. A patient must receive 300 milligrams of a drug in 100 milliliters NS over 60 minutes. How many milliliters must be added to the IV bag if the vial of the drug has strength of 75 milligrams per milliliter? That's our first question. That's part A. At what rate should the pump be set? This is part B. Now, this measurement is usually in milliliters per hour. Okay, so for part A, we take the drug that we want 300 milligrams over, let's put that over 1 times. Okay, my drug has 75 milligrams per milliliter. I want to cancel out the milligrams. So I'm going to put 75 in the bottom to 1 milliliter. Okay, now my milligrams cancel out and I get 300 over 75, which is 4. So I'm supposed to administer a total of 4 milliliters of this drug. That's what I'm supposed to be adding to the bag. Okay, so this is the answer to part A. For part B, the first thing we need to do is to talk about how much fluid is going into the patient. We are adding 4 milliliters of this drug to a 100 milliliter bag. So we take the 100 and add the 4. So we now have to figure out that we have 104 milliliters we need to get into this patient. Okay. At what rate should the pump be set? Okay, so we need to get 104 milliliters into the patient in how long? 60 minutes. Okay, now if this were in other units, we would have to worry, well, we do technically. We're supposed to do milliliters per hour, but 60 minutes is 1 hour, right? I mean, that's our unit conversion. We don't have to worry about multiplying or do anything else because we can just easily substitute. So the rate you need to set up on the pump is 104 milliliters in an hour. And that should be your answer. Okay, and this is the page where they do that. Okay, now I added this slide because the slide that they put together did not talk about titrated medicines and medications, and you do need to know that. Okay, so when you use medications like this is usually for things like pain management. The doctor sets a base. They want you to start out at a particular dose, and then you can go up by certain intervals, and they will specify the top you can have. Okay, so what we want to do here, just first read through the problem. Suppose an order indicates that a certain drug must be administered with an initial dosage rate of 10 micrograms per minute, and that the rate should be increased by 5 micrograms per minute every 3 to 5 minutes for chest pain until there's a positive response, up to a maximum rate of 30 micrograms per minute. The IV bag has a strength of 50 milligrams per 250 milliliters. First of all, let's calculate the flow rate. Okay, so what we want to do for this part is we have 10 micrograms per 1 minute. Okay, and what we want to end up with is we want to end up with milliliters per hour. Okay, well, we have some definite conversions to do here. 1 minute and we want hours, so let's do that conversion. There are 60 minutes in 1 hour. Okay. We need to go to milligrams. milliliters. Here I've got milligrams and milliliters, but right now I have micrograms, so I need to get rid of these. There are 1,000 micrograms in 1 milligram. All right, so minutes are going to cancel. Micrograms are going to cancel. All right. The strength of the drug is milligrams per 250 milliliters. I want to cancel out milligrams. So I'm going to put the 50 milligrams in the bottom and the 250 milliliters in the top. Okay, now that cancels out. And if I do the arithmetic straight across, 10 times 60 times 1 times 250, I get 150,000 milliliters over 1 times 1 times 1,000 times 50, which would be 50,000 hours. And then, of course, you reduce that. 15 divided by 3 is 3 milliliters per hour. Okay, in the next video, we'll complete the titration table.